Hello, my name is Pauline RN. Welcome to my channel. The title of my video is Pressure Injury Staging Wounds. Please hit the thumbs up button. Please hit that subscribe black button. And please share this video with your friends, families, and classmates. Today we are doing questions and answers directly from RN Nclex examinations. My first question, what is your stage 1 pressure ulcer? What is your stage 1 pressure injury? The correct answer is localized over bony prominences, skin is intact, non-blanchable, erythema of the dermis only. Of the dermis only is your correct answer. My next question, what is stage 2 pressure injury? My correct answer is partial thickness, epidermis and epidermis involved. Epidermis and dermis involved. An open injury. Red, pink wound with abrasion, with blister, with shallow crater. Skin is not intact. Skin is not intact is the correct answer. Next, we have stage 3 pressure injury. Correct answer is full thickness, loss of subq, fat visible, dermis epidermis loss, no bone seen, no muscle seen is your correct answer. Next we have our stage 4 pressure injury. Correct answer, what is it? Correct answer, the bone is visible, tendon is visible is the correct answer. Next question, what is DTI? DTI is deep tissue injury. The color is purple or maroon. The color is purple or maroon. Over localized area is discolored. Skin is intact. Skin is intact. Skin is blood-filled blister. Blood-filled blister due to damage of underlying soft tissue is the correct answer for your DTI. Next question. How do patients develop DTI? Deep tissue injury. The correct answer, from underlying soft tissues from pressure or shear. Appearance is purple or maroon. Next question, what is eschar? E-S-C-H-A-R. Correct answer. These are found, for example, on the heels. Skin is dark, black, brown, necrotic, or black dead tissues. Also found inside stage 4 pressure injury. Stage 4 full thickness has to be debrided in order to be visualized. So patients with eschar, we will debride the area in order for us to visualize the injury. Next question, what is tunneling? Tunneling or sinus tract is another name. Correct answer. This is found inside stage 4. Pressure injury resembles a tract. Place a probe inside the tract to be measured. So with your stage 4 pressure injury, We can find tunneling in there. We can find eschar in stage 4, pressure injury. Bone is visible, tendon is visible, tunneling can be visible if present, eschar can be present in stage 4 if visible. And tunneling, you have to document all of these stages of injury in the computer, in your documentation, and you have to insert that probe into your tunneling to measure the track, how far it goes in. My next question is, what is undermining of wound? The correct answer, undermining is caused by erosion under the edges of wounds. Under the edges of wounds. We will swab under the edges of wounds and send a specimen to the lab. We will swab 2 separate parts and send the specimens to the lab for culturing of the wound. Doctor needs to identify which bacteria is present in the wound to order a specific antibiotic to destroy a specific bacteria that is present in the wound. What are complications of surgical wounds? What are complications of surgical wounds? They are dehiscence of wound. They are evisceration of wound. Evisceration and dehiscence of wounds. These are the 2 complications of surgical wounds. My next question, what is dehiscence of wounds? It's spelled dehiscence of wounds. Dehiscence of wounds, correct answer, partial or total separation of surgical wound edges, coughing, sneezing, patient is laughing, patient is turning one side to the other side in bed or moving up in bed. There is total or partial separation of surgical wound due to activities. If this happens, this is an emergency. Call your doctor immediately. Always stay with the patient. Someone else can call the doctor. Do not leave your patient. Assess for any respiratory difficulties. Assess the patient. Stay by the patient. Please note, abdominal pillars are also helpful in preventing wound dehiscence. We use the abdominal pillars after abdominal surgery to assist the patients when they're laughing, coughing, sneezing, moving back and forth to bed to prevent wound dehiscence, partial or total separation of your surgical wound. My next question, what is wound evisceration? It's a surgical wound, and the correct answer is protrusion of internal organs through the walls of the incision due to activities, coughing, sneezing, laughing, moving in and out of bed, up and down in bed. This is an emergency. Call the doctor stat. Assess your patients for shortness of breath, difficulty breathing, Assess your patient for any distress the patient may be in. Apply 2 liters PRN if needed until the doctor gets there. This is an emergency. Do your head-to-toe assessment. Stay with the patient. Do not leave the patient. Someone else can call the doctor. In the meantime, you're with the patient. Apply 4x4s with sterile gloves and sterile water to cover the wound. The wound is protrusion. There's protrusion of internal organs through the abdominal walls of the incision, so you need to cover it with sterile gauze, 4x4s, sterile gloves, sterile water, until the doctor gets there to prevent bacteria, to prevent infection. Next question, what do you know about hemorrhaging? Hemorrhaging is also a complication for post-op patients. What do you do if your patients are hemorrhaging, bleeding? Correct answer, you apply pressure. You stay with the patient. You call the doctor. Do not leave with the patient. Assess respiratory distress. Call the doctor. Please note, for surgical dressings, the surgeon is the first one who changes the first dressings, not the registered nurse. If the patient is in any anxiety, assess their blood pressure decreases due to hemorrhaging, elevated heart rate. Assess patient for anxiety, for profuse bleeding. Apply pressure. Okay, next question. What is DVT, thrombophlebitis? Correct answer is pain in legs, cough, warm, swelling, blueness, redness. Call the doctor stat. This is an emergency. Patients with shortness of breath, difficulty breathing, risk pulmonary embolus, which is a life-threatening condition. Make sure your patient post-operatives are using your SCD sequential compression stockings. Device at the bedside prevents blood clots. What are the signs and symptoms of pulmonary embolus at the bedside post-operative patient? We will assess them for shortness of breath, difficulty breathing, anxiety. Patients who are having chest pain post-operatively, we will do an EKG as ordered by the doctor's stat. Nitroglycerin is ordered sublingually under the tongue. Is a PRN order for chest pain. Post-operative chest pain is a complication of surgery. DVT, thrombophlebitis, is a complication of surgery. Hemorrhaging is a complication of surgery. Evisceration is a complication of surgery. And dehiscence is a complication of surgery. Patient with chest pains, we will call the doctor's stat. This is a life-threatening emergency. All our patients post-operative must be out of bed, ambulating the hallway. Do not keep them in bed. Please hit the like button. Please hit the black subscribe button. Please share this video with your friends, relatives, and classmates. This was part 3. Stay tuned to part 4. Thanks for watching. Have a good day for skin integrity. Thank you.